Today we're going to bring you behind the scenes into the radiologist reading room to show you what we do on a daily basis. Come on. So the first case here is a wrist x-ray series, and this was a child who fell down. It's a very common injury. You fall in the outstretched hand, and they sent them in to be, their doctor sent them in to be evaluated. So if you look closely here, you can see these are all the bones of the wrist. And in the distal forearm, we can see what we call a cortical buccal or torus fracture. Now this patient actually has fractures of both the radius and the ulna. These are very subtle fractures, but they are real and would need to be treated. Here's another view of them, a subtle little lucent line here and a little cortical buccal of the distal ulna. And this is an example of a pediatric wrist fracture. So here's another example. In this case, they're doing a full forearm, similar injury, child who fell. And again, you can see maybe a little more conspicuous here. If you can see here, this is a fracture of the distal left radius. And sometimes these can be subtle. And a lot of times we need different views and projections to be able to see the fracture well. And in this case, you can see here, bone should be very smooth. And on this case, it comes up, and then you have a little cortical buccal here. So these are considered fractures, and generally they need to be immobilized in a splint or a cast, and the body will heal them themselves, particularly at this age.